Our next guests are from Risk Management Solutions, and they're Matt Nielsen, Senior Director of Government and Regulatory Affairs, Maria Lomelo, Director of Product Management, and Brice Jabo, Medical Epidemiologist, who will provide us with a presentation on pandemic modeling. Matt, before you get started, I will tell you to go ahead and use your slides, but we may have an issue in advancing the slides, but don't let that slow you down. You just move on to the next topic and we'll catch up on the slides as we can. So welcome, Matt.
Thank you very much, Director Farmer. I appreciate that. And thanks to the NAIC for essentially putting together this great program today and gathering all of us together, and for including RMS. I also want to thank the Center for Insurance Policy Research for working with us closely, not just on this catastrophe, but several catastrophes over the last year to 18 months. So what we'd like to do today is give a bit of a tour and a preview of our pandemic modeling capabilities. So we'll start off by talking about the methodology that we use to build a pandemic model. And then we'll explore some of the historical comparisons, some of the scenarios that also come along with the model. And then we'd like to wrap that up by talking a bit about how this model is used in the insurance industry, particularly by life and health insurers. So what I'm going to do is I'm actually going to turn things over to two of our experts who were just introduced by Director Farmer. So that being Brice Jabo and Maria Lomelo. Now, both of these individuals work very closely with our pandemic model, and they are going to be taking us on the tour of that model today. So Brice, I'm going to go ahead and hand things over to you. Brice, you might be on mute. So you might want to check.
Brice, if you want to take off mute, unfortunately, we can't hear you right now.
Hi, this is Maria. If you want to advance the slide, please. One more. Thank you. I'm just going to first kick things off before Brice talks about the details of the model, just to provide a bit of a context in which companies utilize our infectious disease model. This falls into the broader context of how companies manage mortality-related risks as a whole. And this risk comes in two different areas. So one is extreme mortality risk, which looks at shocks to individual life and health portfolios. So infectious disease modeling is certainly a driver of that, but it also includes other types of risks such as terrorism, earthquake, and other causes such as industrial accidents, floods, extreme temperatures. On the flip side of that, risks also arise from uncertainty in what future mortality will look like, and this has an impact on liabilities for pension and annuity companies. So while we have been focusing a lot on the COVID-19, I wanted to put in perspective how managing mortality risks is in a broader context. Next slide. I'm going to hand this over to Brice Jabo now. Thank you.
Unfortunately, we are still not able to hear Brice.
Matt or Maria, do you want to continue for Brice?
Yeah, I'm going to hand this over to Maria.
Yeah, so while Brice is getting his audio set up, I can provide a background on the infectious disease model. Modeling of infectious disease risk is not new for RMS, so we started development of an infectious disease model back in 2006. We released our first probabilistic model in 2007, which focused primarily. Oh, yes, we can hear you now.
All right, Brice, take it. It's your turn now. Go ahead. Maria, could
Perfect. I was saying that the RMS infectious disease model has gone through multiple iterations, and starting in 2007 when we released our first model. And this is the second pandemic our model has to deal with, the first one being the 2009 pandemic. And over those years, the model has gone through multiple iterations. The latest edition was released just in November 2019 and has included country-specific parameters, and we have expanded the model for 59 countries. We have also brought in demographic profiles to account for different mortality profiles for different age groups. We have also provided vaccine and pharmaceutical modifiers that are different for different countries to allow our clients to see differences that we observe in real life between different countries. Next. The foundation of our model is based on an epidemiological model, usually known as the susceptible, infected, and recovered model. And in our model, we have more than 4,500 scenarios, and those combine influenza and emerging and re-emerging disease scenarios. And those are based on, we arrived at those scenarios by combining various pathogen characteristics that include transmissibility and virulence. And virulence here, we want to mention that's how severe the disease can be. We also look at the age profile. As Dr. Butler has mentioned, every disease, including COVID-19, have different mortality and morbidity profiles as far as age is concerned. Also take into account the availability and effectiveness of different pharmaceutical products, vaccine, and as well as non-pharmaceutical intervention. And right now we are still in the non-pharmaceutical intervention phase where there is no vaccine, there is no pharmaceutical. We're heavily relying on the non-pharmaceutical interventions. Next. And we are now going to try to explain what we have been doing as RMS in working with our clients in the insurance and the reinsurance industry. And our work has mainly consisted in keeping up to date with the development. As the previous speaker mentioned, we didn't even know this disease existed only 3 months ago. So a lot of the work has been done on just understanding the characteristic of the pathogen that causes this disease, as well as the effectiveness of other interventions. So a good understanding of pathogen characteristics matters because this allows us to advise our clients accordingly and also help them select the appropriate scenarios from our model that would match the events that we see on the ground. There are two key pathogen characteristics that we focus on. Those are transmission and virulence. Transmission, we use the basic reproduction number, and that's the average number of people that one infected case can produce. And right now, the numbers we see that one case of COVID leads to 1.5 to 3.5 on average new cases. On the virulent side, we focus on the case fatality rate or the infection fatality rate. And those are the number of people that die among those that are infected. And this is a tricky one because this requires a good count of the infected, and this is not usually done. And we don't know places that have done it perfectly, but we have done our homework to try to understand, at least to get the right ballpark on where those numbers can be. So when you want to look, once there is a pandemic, you want to look at a closed system to try to understand what's going on. And usually closed systems don't exist. But for this pandemic, we had one closed system, which is the Diamond Princess cruise ship. And by looking at that, we can actually get as close as we can to the reality because all of the other factors, external factors, were removed. And the case fatality rate for those passengers on the Diamond Princess cruise was the estimate, the median estimate was 1.2 with a range of 0.4 all the way to 2.7. And the numbers, the next place where we have seen tremendous testing is South Korea. And you can see whenever there is testing of total or close to a large amount of people, the estimates are always around 1.1, 1.2. And right now in the US, when we use the naive approach of taking the number of deaths over the number of tested, we have 1.5, but the numbers are heavily biased by the testing. There was a question by Commissioner Conway about the case of Italy. You can see the case fatality rate. This is again a naive case fatality rate of 8.2%. This is heavily biased by the testing. So we need to take these numbers in context. So if we were to say of the published numbers, the ones that would probably reflect more, closer the reality are those from the Diamond Princess cruise and those from South Korea. Next. Next, we want to look at the effectiveness and the swiftness of the non-pharmaceutical interventions. And this matters because, again, when they are applied in a timely fashion, they modify the parameters we just mentioned about the transmissibility and the virulence. And these non-pharmaceutical interventions are measures that are used in absence of vaccine or effective drugs, and that can help slow down the progress of the disease. And those things include travel restriction, things that we have seen, school closure, movement restrictions, like the type of measures that were being seen applied in California, in Washington State or New York. Those are non-pharmaceutical interventions because they don't rely on any clinical or pharmaceutical aspect. Again, we track these, we track how they affect the disease progression because in the end, they modify the way we advise clients on which scenarios to choose from our model. Next. Demographic profile matters. And this ties back to what Dr. Butler from CDC has mentioned already. The various pathogens have various morbidity and mortality distribution across the age groups. And in this process, we have basically evaluated all the available data, all the available evidence to be able to see what is the profile and how those profiles match the demographic profiles that RMS has already in our infectious disease model. And on this data from China, you can see on the left in green, the Chinese population distribution, and the middle, the number of cases. On the far right in the red, you see the number of deaths. And you can see, as already mentioned previously, the number of deaths is heavily concentrated in the old population, and it's pretty much non-existent once you are below age 20. Next. Continuing in that with the same trend, underlying population health matters too. And things, again, this is good to follow the CDC because a lot of this have already been touched on. Understanding pre-existing condition, that they increase the risk of death and more of disease and death. And we have seen this in Italy, we have seen this in China, and we're seeing this in the US. And of all the comorbidities that have been evaluated, we see that hypertension, high blood pressure, diabetes, as well as cardiovascular disease are right there on the top. And then once you can also go and look at the US distribution of those diseases, and then you can get a sense of where and how people are gonna be affected once this pandemic spreads across the country. Next. Additionally, future development matters. Right now, we don't have an effective treatment, and we don't have an effective vaccine. But as already mentioned, trials are underway for both treatment and the vaccines. And our model we have already includes parameters to take into account the effectiveness of vaccine, the effectiveness of treatment, and the availability of these parameters allows our clients to conduct some what-if scenarios. Right now, our clients can go in the model and say, what if there was an epidemic, a vaccine against this epidemic? What if there was an effective treatment? And they can also choose the level of effectiveness for both, and then they can estimate their losses given those what-if scenarios and using whatever assumptions they feel comfortable with. Again, we are working to advise our clients what scenarios and what assumptions are plausible given everything we know so far about the disease. Next. Now, every model needs to be validated, and that's no exception for the RMS infectious disease model. And we have tested our model against a historical event, and this is a slide for historical US events. And you can see that on the green line, these are our model when we say there was no intervention. So this is what our model would say what would happen before modern medicine. And on the green, on the red curve shows the current settings where we have medical interventions, we have vaccines, and you can see historical events fall between the no intervention curve, the green curve, and the current curve. And as I mentioned, our model has been used previously during pandemic, especially the last pandemic, the H1N1 in 2009. And you can see on the table our model projections and what the CDC estimate ended up being. And our model D wasn't far off from what the CDC estimated the morbidity and mortality to be at the end of the pandemic. So to recap, our model helps our clients estimate right now what the losses will be once the pandemic is over. But in addition to that, we also continue to progressively assess the progress of the pandemic so that we can help them understand how things are evolving and which type of scenarios they should be choosing based on our model. Next. I will go back to Maria so that she can talk more around the business and application of our model.
Mm-hmm. Yeah, I'll wrap up just talking a little bit about how RMS's models are used in the life and health industry. I have a few of the key business cases, the first being scenario reporting. So our model looks at a full loss distribution, but also highlights some key historical or hypothetical scenarios. A very common scenario that is used by many companies is a reoccurrence of the 1918 influenza pandemic. It takes a look at what that reoccurrence would look like today, but also looks at the variations among different demographics, as well as different vaccination and pharmaceutical impacts. Another use of the model is for economical or regulatory capital requirements. So for life catastrophe risk, looking at a 1 in 200 year return period to assess what those additional capital requirements may be. Companies can then also examine key drivers of the risk, so how their individual age distribution or the underlying health of their portfolio contributes to the loss. It also allows them to run different types of sensitivity tests so that they can stress model parameters and have a very solid view of their own view of risk. And then the last case I just wanted to bring up is risk transfer. So ultimately trying to understand what reinsurance levels and structures are appropriate for their book of business. This can be transferred through traditional reinsurance as well as securitization of the risk. RMS has worked on a number of insurance-linked covers in the past few years. Next slide. And just a final note, as Brice mentioned, our model has been used to model historical pandemics before. We've also done a lot of work with some near-miss catastrophes that have occurred in the past decade or so. So our model does take into consideration a number of hypothetical scenarios that companies can use to manage a what-if scenario. We also look back to previous epidemics to see how they could have been worse. So just a few examples here, and looking at, okay, if those types of events were, say, SARS, for example, more transmissible, what would those impacts be on a portfolio? There's also been a lot of discussion recently about looking at a financial stress test for COVID-19. Lloyd's is also considering adding pandemic as part of their realistic disaster scenario. So we do work with these organizations to understand the parameters around which they develop these scenarios, and we also help assist our clients in responding to these questionnaires. Thank you. Next slide.
Yeah, thank you very much. That was our presentation for today. Obviously, that's a very short tour of the models that we have, but we want to be able to do two things. One, if time allows, we can answer some questions here, and two, make ourselves readily available to answer more questions from any of the interested parties on the phone. Certainly, you can reach out to the NAIC. There are folks there that know how to contact us, and we're happy to continue the dialogue.
And that's really going to be the process, Matt. I'm told that this webinar is extremely successful. We have over 2,500 people online, and we have been inundated with great questions. So for people asking questions, continue to ask them. We will not have time to get to hardly any of them, but we will pass those along to the experts. And the questions and answers will be posted on the NAIC website in the very near future. We have time for one brief question with a real brief answer from Director Cameron. Or I think he's decided to wait on that for a little while. So thanks again, Matt, Maria, and Brice for such an enlightening discussion on potential directions that the pandemic might take.